Hello students, welcome once again to the channel Physiology Redefined. Today in this video I will talk about what is anemia, how the anemia is graded or the grading of the anemia, how it is done, what are the types of the anemia, and finally what are the signs and symptoms of the anemia. So to know all about the details of these things regarding the anemia, please keep watching till the end of this video. So let us start the topic, that is anemia. So first is regarding the definition. What is how the anemia is defined? Definition of the anemia. Anemia is defined as the clinical condition. It is the clinical condition, diseased condition, which is characterized by decreased oxygen carrying capacity of the blood. So this is decreased oxygen carrying capacity of the blood. And why the decreased oxygen carrying capacity of the blood takes place? This is because of the either the low RBC count than the normal range, or the low hemoglobin concentration below the normal range. So because of these two reasons, either there is a lower RBC count or there is lower hemoglobin concentration, or both the factors. Because of these factors, if the oxygen carrying capacity is decreased, then that clinical condition is known as definition. So before summing up the definition, let us know what is oxygen carrying capacity of the blood. Oxygen carrying capacity of the blood is the amount of the oxygen that is carried by the hemoglobin. Amount of the oxygen that is carried by the hemoglobin. And generally 1 ml of the hemoglobin, 1 ml of hemoglobin, this can carry 1.34 ml of oxygen. Sorry, 1 gram of the hemoglobin, 1 gram of the hemoglobin, 1 gram of the hemoglobin can carry 1.34 ml of the oxygen. Now, if a person is having 15 gram of the hemoglobin in his or her body, a person suppose is having 15 gram hemoglobin in his body, in his blood, 15 gram hemoglobin. So hemoglobin concentration is 15 gram hemoglobin. In such a case, what will be the oxygen, amount of oxygen that can be carried by the entire amount of this hemoglobin? That is 15 into 1.34 ml. That comes around 20 ml of oxygen. So oxygen carrying capacity is the amount of the oxygen which is carried by the entire hemoglobin present in a person's blood. So that is known as the oxygen carrying capacity of the blood. This is around 20, normally it is around 20 ml oxygen. If the hemoglobin concentration is 12, suppose, then it should be, so if the hemoglobin concentration is 12, then the oxygen carrying capacity will be 12 into 1.34 ml. So in this way, oxygen carrying capacity can be obtained by multiplying the amount of that oxygen carried by the each gram of the hemoglobin multiplied by hemoglobin concentration. So this is known as the oxygen carrying capacity. So Now, as per the definition is concerned, it is the clinical condition characterized by decreased oxygen carrying capacity, either due to decreased RBC count, below the normal level, or decreased hemoglobin content, or both. So this is how the anemia is defined. Now question comes, how the anemia can be graded, how it can be considered that someone is suffering from mild anemia, someone is suffering from very severe anemia. So that is known as the grading of the anemia. And as per the ICMR guidelines, what is the grading of the anemia? In case of mild anemia, the hemoglobin content will be 10 to 11 gram percentage. 10 to hemoglobin percent. If the person is having 10 to 11 gram percent, then the person is termed as mild anemic. Generally 12 gram percent is considered as the normal in the Asian population context. So if it is in between 10 to 11, the person is considered as mild anemic. There is the moderate anemia. If the hemoglobin concentration becomes 7 to 9.9 gram percent, this is considered as moderate anemia. Then severe anemia. If the hemoglobin content is in between 4 to 7 gram percent, then the person is considered as severe anemic or severe anemia. And finally, very severe anemia. If the hemoglobin content is 4 gram percent, is below 4 gram percent, then the person is considered as severe, very severe anemic. So this is how, as per the ICMR, grading of the anemia is done. Now is about the classification of the anemia. Classification of anemia. There are two types of classification of the anemia. One is the morphological classification and second one is known as the etiological classification. Morphological classification was given by Winthrop's and thereby it is also known as Winthrop's classification. So morphological or Winthrop's classification. As per this morphological classification, the anemia are of mostly three types. First one is known as the normocytic, normochromic. So what is normocytic, normochromic? This classification, Winthrop's classification, morphological classification, is based on two parameters of the RBC indices. First one is the MCV and second one is the NCHC. Normally MCV is in between 75 to 98 cubic micron and MCHC normally is 30 to 38%. So based on these two parameters, the morphological classification is done. If the MCV is lower than the 75, the anemia or the RBC is known as the microcytic. Size is small, so MCV is low, so size is small, so microcytic anemia. If the MCV is more than the 100 cubic micron, that means size of the RBC is large. So size of the RBC is large means MCV is more than 100 cubic micron. In such a case, that type of RBC is known as macrocytic RBC, and that anemia resulted is known as macrocytic anemia. Similarly, if the MCHC, mean corpuscular hemoglobin concentration, if it is below 30, then the condition is known as hypochromic, little hemoglobin, little color, low color, and the way hypochromic. So less than 30% of the MCHC means hypochromic, and more than 38% is known as hyperchromic. But in reality, hyperchromic anemia cannot take place because this is the maximum capacity of the RBC to accommodate the hemoglobin, that is around 38%. So hemoglobin is completely saturated within the RBC, and thereby hyperchromic anemia more than the 38% hemoglobin cannot be accommodated in the RBC, and thereby hyperchromic anemia can practically not possible. So with this idea in our mind, let us see now what is normocytic normochromic. So normocytic normochromic means, as I told, there is a in this case the MCV and MCHC both are normal. Size is normal and hemoglobin content is normal. So MCV and MCHC both are normal, even if the person suffers from anemia. And this is because in this case the RBC count, there is a decreased RBC count. RBC count is less. So MCV is normal, MCHC is normal, but RBC count is decreased in case of normocytic normochromic anemia. And this happens, this type of normocytic normochromic anemia, this is seen in number one, accidental blood loss. Any type of acute accidental blood loss, that is known as blood loss anemia. It can be because of the injury, it can be because of the surgery. So blood loss anemia or accidental blood loss, this can be seen. Normocytic normochromic can be seen. Second one is the hemolytic anemia. In case of hemolytic anemia also, this type of normocytic normochromic anemia can be seen, RBC can be seen. What is hemolytic? In this case, what's happening? Because of some factors. It can be the external, it can be the internal, it can be some infections, it can be some drug reactions, it can be some antigen antibody reactions. Due to this, if the hemolysis of the RBC take place very quickly and RBC production cannot compensate the RBC lysis or RBC breakdown, then that type of anemia is known as the hemolytic anemia. In such a case, RBC count will be low, but both of these parameters are normal. So this is the first type of anemia, that is known as normocytic normochromic. Second type of morphological classification is known as the macrocytic normochromic. So in this case also macrocytic. So MCV is greater than 100 cubic micron. MCV is more, but MCHC MCHC is normal. And this is why it is the normochromic. MCHC is normal. This is why it is normochromic. And this type of anemia, this is seen in vitamin B12 and folic acid deficiency. Folic acid deficiency in the diet. Folic acid deficiency in diet. So in case of, if in the diet folic acid is deficient and vitamin B12 is deficient, then what's happened? RBC cannot mature. As I told in my earlier video, that there are some factors that affect the erythropoiesis, of which maturation factor is one of the factors. In these maturation factors, vitamin B12 and the folic acid is very, very important factor. That is responsible for DNA synthesis. So because of the absence or deficiency of vitamin B12 and folic acid, DNA synthesis will not take place, so RBC will not be matured, so its size will be larger because of the immature RBC, and that type, because of that factor, the RBC will be larger in size, so MCB will be more, and that anemia is known as macrocytic normochromic anemia. Third type of morphological classification is known as microcytic hypochromic anemia. Microcytic hypochromic anemia. So in this case, what's happened? Number one, microcytic. So MCV is less than 75 cubic micron. MCV is decreased, and MCHC is also decreased below 30%. So both the parameters will be decreased. So microcytic and hypochromic. And this is seen, this type of anemia is seen in iron deficiency anemia. Iron deficiency anemia. So if the iron is deficient in the diet, then as you know that iron is a very integral part of the hemoglobin, and that helps in oxygen binding. So as the iron is deficient, hemoglobin will not be formed, hemoglobin will not be formed, and thereby the oxygen carrying capacity will be decreased. Hemoglobin, RBC will contain very low amount of the hemoglobin, and the size of the RBC will be also very small, and this is why it is known as microcytic hypochromic anemia. So this is all about the morphological classification or Winthrop's classification. Now is about the etiological classification. Etiological classification, or on the basis of the cause, based on the causative agent, and this was proposed by scientist Jaypee, and thereby it is also known as Jaypee's classification. Jaypee's classification. So as it is based on cause, so this is based on cause of the anemia. So as per this etiological classification, first one is known as the hemorrhagic anemia. Hemorrhagic anemia. That means if the anemia is due to blood loss. If the anemia is due to, this is due to, number one, blood loss, acute blood loss. Number two, there may be the continuous uterine bleeding. There can be the purpura. So these are the different causes because of which the blood is continuously lost from the body, and thereby that condition is known as hemorrhage. And if the anemia is due to hemorrhage, loss of the blood, then that type of anemia is known as hemorrhagic anemia. Second type of anemia, etiological classifications. Second type of anemia is known as hemolytic anemia. Hemolytic anemia. So in this case, what's happened? The hemolysis of the RBC takes place. Hemolysis of the RBC takes place. RBC, blood is not getting lost from the body, but RBC, whatever RBC are there, they are very quickly, rapidly, they are getting damaged due to, so hemolysis of RBC. This is due to what factor? There can be the sickle cell anemia, because of the glucose 6-phosphatase deficiency, because of the hereditary spherocytosis, and there can be the allergic reactions or drug reactions. So because of any of these reasons, if the hemolysis of the RBC takes place, it can be even because of the infections like the malarial infections. So in such a case, what's happened? Hemolysis of the RBC takes place, so RBC count will go down, and that will result in anemia, and that anemia is known as hemolytic anemia. Third type of anemia is known as the nutritional deficiency anemia. So if the anemia is due to deficiency of the nutrients, and that nutrients can be the proteins, that nutrients can be the iron, that nutrients can be the vitamin B12 or folic acids. So because of deficiency of any of the dietetic factors, if the anemia is resulted, that anemia is known as nutritional deficiency anemia. So it is the deficiency of the nutrients, deficiency of nutrients in the diet. Nutrients. What nutrients? What are the nutrients? Like protein, like iron, like vitamins, B12 especially, and folic acid. These are the different main nutrients that are responsible for resulting the nutritional deficiency anemia. And lastly, there is aplastic anemia. So aplastic anemia, that means atrophy of the bone marrow. If the atrophy of bone marrow takes place, you know that from the bone marrow, the hemocytoblast cells, stem cells of the bone marrow, that gives birth of the RBC. So as the atrophy of the bone marrow takes place, in such a case, what's happened? The RBC will not be formed, or low amount of the RBC will be formed, and this is why that type of anemia is known as aplastic anemia. And this aplastic anemia generally happens in case of chronic or long-term X-ray radiations, long-term X-ray radiations, or also some other causes that can, because of some congenital causes, some disease conditions, what's happened? Aplastic anemia takes place because of the atrophy of the bone marrow. So this is about the etiological classification or Whitby's classification. So this is about the classifications or types of the anemia, which is based on morphology and also the causative agents, reason of the anemia. So now there are signs and symptoms of the anemia. Lastly, there is signs and symptoms of anemia. That means how you can understand the person is suffering from anemia. So from some signs, from some symptoms that appears in the body, that complains the patient, from those things you can get about the person is suffering from anemia. What are those signs and symptoms? First one is the very pale skin, mucous membrane, gum, lips, nail bed. So there will be very pale colored skin, there will be very pale colored mucous membrane. What if the oral mucosa is seen? It will be very pale color. The gum will be pale, the lips will be pale, the eyes will be pale, and the nail beds will be pale, very pale in color, not reddish in appearance. So that is the first clinical signs and symptoms of the anemia. Second one is the rise of the heart rate. As you know that RBC count is low, so body will try to increase the oxygen supply by some compensatory mechanism. As the RBC count is low, so obviously oxygen supply to the tissue will be low, so body will try to compensate that. How to compensate? By increasing the pumping activity of the heart, so that very quickly heart can pump the blood to the tissue, and this is why the heart rate will be increased. Similarly, there is a rise of the respiratory rate. Respiratory rate will also be increased because as the RBC count is low, hemoglobin content is low, what's happened? To increase the supply of the oxygen to the tissue, the more oxygen will be taken up by the has to be taken up by the lungs, and this is why the respiratory effort, respiratory rate and depth, and increased respiratory depth of that is also increased. Then there is a nausea, very vomiting tendency, nausea, vomiting, and also constipation. Constipation. These are the another signs and symptoms of the anemia. Next one, in case of females. In case of females, there can be the menstrual abnormalities. So this is why if a woman after the puberty they are having irregular periods, irregular menstrual cycle, then doctor used to first give the test the hemoglobin content and the RBC count to know whether the person is suffering from anemia or not. If the anemia is not the case because of this menstrual abnormality, then the doctor treats the person accordingly. So anemia can also result the menstrual abnormality in case of women. Besides these, there are some general signs and symptoms. General symptoms. What are those? Like very drowsiness. There is a irritability. There is also fainting, and there is also fatigueness. So all these are the general symptoms of the anemia. And in severe cases, if the anemia is not corrected, in severe cases, then what's happened? There can be the increased size of the heart, and that even can cause cardiac failure or heart failure, and that can result even the death of the person. So anemia is, though it is not that much we do not give that much attention to the anemic patients. But in case of severe anemic patients, in case of severe anemia, the person can even die because of the cardiac failure. So this should be kept in your mind. So these are different signs and symptoms of the anemia, on which basis we can identify whether the person is suffering from anemia or not suffering from anemia. I hope the concept regarding the anemia is very clear to you. And if it is clear, if you like this class, don't forget to share it, like it, and subscribe the channel if not yet subscribed. Thank you.